that's direct from the plant. But when you eat meats, you're eating all the process of the cow growing his meat, right?
Yeah.
That's probably why vegetarians become vegetarians. They don't want to eat the meat of other animals.
Right.
And studies show sometimes there's not a why in life. Okay, sometimes there's an observation. Taking digitalis helped the heart. It was an observation, or penicillin. We didn't know exactly why the mechanism, but we observed that it did do it.
Right.
And sometimes, like you hear all these commercials about taking vitamin XYZ and cockamamie oil and all that stuff, and they give you 50,000 reasons why it's better for you, right?
Right.
But that's not proof. The proof is you get 1,000 patients and half take cockamamie oil and half don't take cockamamie oil, and you see which half do better.
Sure.
A lot of these infomercials and commercials, they don't actually give you that data, and actually the data doesn't exist.
Yeah.
So sometimes there's not a why. In medicine especially, there's not a why.
That's true.
People always want to know why. But the first thing to know is, does something work? Right? You're a medical student, you're doing surgery now.
Yeah.
So when you do surgery, you want to know, is the procedure that you're doing scientifically sound? A woman who has breast cancer, she's choosing lumpectomy to remove the lump of cancer, or she's choosing mastectomy to remove the whole cancer. And there's actually scientific data showing that woman that she doesn't need to do a mastectomy for most cases.
Mm-hmm.
I mean, I'm not talking about unusual cases, but let's just say
Right.
she has a 1 centimeter or 2 centimeter or 3 centimeter cancer in the breast, and she wants to keep that breast. 100 years ago, she didn't have that choice. 100 years ago, she was getting a mastectomy, and they were often doing a radical mastectomy. Do you know what a radical mastectomy is, by the way?
As opposed to a regular mastectomy?
Well, what's a regular mastectomy?
So they take out the entire breast pretty much.
Well, no. A radical mastectomy was removing the breast and the muscles underneath the breast. Now, a woman has the same muscles under her breast that a man has.
Right.
And those muscles are?
Pectoralis.
Yeah, the pectoralis. And what does a pectoralis muscle do?
I don't remember.
Well, it helps rotate the arm.
Mm-hmm.
I mean, it's connected to the humerus and helps rotate the arm. If you put your hand on your chest and rotate your arm, you'll feel your muscle moving. So when you lose your muscles, you're losing function of your arm.
Right.
So there were studies done eventually that looked at radical mastectomy versus modified radical mastectomy. So what you call a usual mastectomy is actually a modified radical mastectomy where the muscles are left intact.
Okay.
And there was a doctor in New York for many years, many years, who did a super radical mastectomy. Not only did he remove the breast and the muscles, but he removed the ribs underneath.
Wow.
And I've seen results of that. There's a guy named Halstead, and he was doing super radical mastectomies. And you could examine that woman, and you could put your hand on her skin of her chest and feel her heartbeat.
Wow.
So there's scientific data for everything that we do, or there should be scientific data. And then they're out there selling these vitamins and herbs telling you, well, it works. It works by process number 62, and it contains mineral oil number vitamin 506. That's all baloney.
Right.
You know, the question is, have they done randomized studies to show that the group of people that get it versus the group of people that don't get it do better?
Mm-hmm.
And so actually there are randomized studies that show that people who have colon cancer, not who gets colon cancer. We know that if you have less red meat and less processed meat, that you have a lower risk of cancer, probably because there's less toxins. Probably having that cow eat your oats and cow eat your corn and your cow processing it and then you eating the cow is probably more toxic than if you eat your oats and you eat your corn.
Yeah.
And it makes sense,
It
right?
does. Yeah, it does make sense.
Right. So that's why, if you want to probably have the best diet, it's probably eating more fruits and vegetables and exercising and sleep and not smoking. And smoking is the same. Why does smoking hurt you?
All the toxins and chemicals.
Yeah.
Right.
So smoking hurts you because you're putting the toxins, and probably eating that meat hurts you because you're probably getting the toxins of that cow, whatever it is, or the mechanisms, or the fat, or whatever's in that cow.
Yeah.
And it's not just, the cow is not just the cow. It's They're giving the cow vitamins and all kinds of medicines to promote beef growing on the cow.
Right.
And maybe some of those promotion medicines promote cancer.
Yeah.
So there's lots of possibilities, but the fact is, yes, if you eat a lot of red meats and processed meats, that you'll probably have a higher rate of cancer. And yet the study shows if you have colon cancer and you eat red meats or not, the prognosis is the same.
Mm-hmm.
So maybe the period of time is different. Maybe if for 60 years you eat red meats, that's giving you the colon cancer. But for, let's say, the 6 months of your treatment, whether you eat red meats or not, it's probably too short a time.
Right.
That's just a theory.
Yeah.
Anyway, we're live. This is Dr. Lederman. I'm here with Rob Spencer. We're on the Radiosurgery Hour. We're here to try to give you information about how to live longer, live better, get better treatment if, God forbid, you have cancer, get better treatment. And today we have a special phone line, which is our office phone line, 212-CHOICES, 212-246-4237, 212-246-4237, which is 212-CHOICES. For me, I can never remember a phone number if people say it only once. So that's why I always say it more than once. An interesting woman came to us this week. She was a Russian-born woman, didn't speak English. She felt this mass growing in her groin last Christmas time,
Okay.
so quite some time ago. She got an MRI, and the doctors thought it was a schwannoma. So do you know what a schwannoma is?
So it's a cancer of the Schwann cells. Which
No, it's omas. Whenever it's omas, it's benign.
Okay.
Like acoustic neuroma or vestibular schwannoma.
Mm-hmm.
Omas are benign.
Right.
So they told her it's a benign tumor. She had an MRI elsewhere, and she was satisfied with that answer, which is always probably a mistake. You probably always should get a second opinion because she felt this thing growing. A year ago it wasn't there. It was a growing mass. So usually benign tumors are pretty slow growing, don't change very much. Usually cancers keep on growing because they have no controls on their growth.
Mm-hmm.
So she was falsely reassured in January, and then it was growing. She got a new MRI which showed the tumor is bigger. Now, tumor is a word that can be used for benign or malignant
Right.
disease. So when it got bigger, the doctor said, well, maybe it's something more serious like a sarcoma or cancer. And a sarcoma is one of those, it's a cancer of the connective tissue. So it's not always omas, but sarcoma is a cancer of the connective tissue.
Mm-hmm.
And I apologize for that. And then she got a PET scan.
Okay.
And the PET scan lit up like bright lights.
No.
And so PET scan is an injection of radioactive materials, radioactive sugar. It goes throughout the body, and it tends to go to tissues that use a lot of sugar.
Right.
I mean, so your brain will light up because your brain's using a lot of sugar. It's really functioning. Let's see here, folks. We got a call, and we're going to answer this call and see if the system works. Good morning. You're on the air on WOR. This is Dr. Lederman.
Dr. Lederman, I was wanting to find out what can you do for my friend's 35-year-old son with a brain tumor. He had a biopsy done over at Sloan Kettering, told it was infiltrating, and he had maybe 3 years to live.
All right. Has the patient been treated yet or not yet?
Not yet.
All right. Well, we'd want to see the scans and reports and meet with them. We were the first ones to do brain radiosurgery in New York. Brain radiosurgery means we can focus treatment on the tumor and not hurt the healthy brain. So while other places were doing standard radiation, which was often radiating the whole brain, and still, I'm going to tell you a story shortly about a woman just yesterday was recommended whole brain radiation. We're able to hit the tumor, and by hitting the tumor, it's more successful in treating the tumor and avoiding harm to the healthy tissues. So if they want our opinion, the best thing is to get the MRI to us so we can review that, and we'll have it independently reviewed by our panel of experts. Number two, we have a booklet and a DVD if they just want to read about our work. And obviously they're welcome to call or write anytime they want, and we'll try to help them out.
Excellent. Thank you very much. I'll have them do that.
All right. God bless you. Thank you. And if you call us during the week, we will send you a booklet and a DVD out to you or to them or to both, whatever is good for you.
Perfect. Thank you very much.
Thank you, and God bless you. Bye-bye. So now that we've proven the system of my cell phone work, and WR has no reason to fix their phones. So anyway, yeah, this woman had a tumor in the groin, the woman I was talking about before.
Right.
And she came to us. She was going to have, her surgeon thought he could not ever, ever, ever remove it. He thought it was stuck down to all the tissues, and she came for radiosurgery. Well, sometimes we don't do radiosurgery. Sometimes we try to do something that's better for the patient.
Yeah.
I mean, the goal is to do the best thing for the patient. So I called the doctor who did the PET scan. The doctor who did the PET scan said, hey, I think that this is encapsulated and the surgeon can remove it easily. So then we got the MRIs together and brought them to the same doctor, who's a fantastic doctor, and he read them all. And he said, yeah, I've read the MRIs now, I've read the PET scan now, and this is an encapsulated tumor. It's not stuck down to anything. Because prior to this, the surgeon felt that it was stuck down to the nerves and the blood vessels in the groin.
Right.
And he could never get it out in a million years. So it was fantastic to have a team working together, and a team that calls for the images, reviews them, speaks to the doctors, coordinates the service. And this was all on Tuesday. This woman came to me on Tuesday this week. On Thursday, she had successful surgery, totally removing the tumor.
Wow.
So we believe it's a malignant nerve sheath tumor. I'll report back in a week or two. Maybe we'll still give radiation depending on the features of the cancer. The biopsy showed that it was a very high grade, which means aggressive, which means under the microscope it looks like it's going to grow and cause problems. But her PET scan did not show any metastasis.
Excellent.
So we hope that she's home free.
Yeah.
And one thing I like to tell people about, many patients come to me and they never have their reports. I don't know about you and your medical system there, but the patients don't have their reports. They don't have their biopsy. They don't have their CAT scans, the PET scans, the MRIs, and they're wandering around in a fog.
Yeah.
And I think it's really unfair to the patients that they don't have copies of their reports.
It's true.
And so when patients come to us, we give them copies. So they walk away with the copies of the pathology, the copies of the biopsy, the copies of the MRI, the CAT scan, the PET scan, and they can review it. And I think it's reassuring for the patient to know the same thing that the doctor knows.
Absolutely.
And often the patient spends a lot more time reviewing their records than the doctor. They may spend hours, which is good for them. It gets them involved in the process. And rather than just trusting these words that they hear, they actually can see it.
Yeah.
And I often review the scan. So the more quality you give the patient, I think the more they appreciate your time with them.
I agree.
So we're going to break for a commercial message from our sponsor with the Golden Voice, and we'll be back in just a few minutes. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212 Choices. 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212 Choices. 212 Choices for Radiosurgery New York.
News Talk Radio 710
WOR.
At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best